We do have some new RET inhibitors that are on the horizon. And I think these can be divided into a couple different categories. So first of all, we have some drugs that were developed for other purposes that are often mixed inhibitors, meaning they inhibit RET, but they might inhibit something else as well. Now we have some older ones like vandetanib and cabozantinib that inhibit RET, but also can block other pathways like VEGF receptor. And that may be a good thing. You know, sometimes blocking two different things can make the drug more potent, but it also may have a downside, which is that there might be more toxicities associated with that. For example, vandetanib was not the best RET inhibitor, but it inhibited VEGF receptor and EGFR, which we think was beneficial. So those are sort of the mixed inhibitors or the multi-targeted kinase inhibitors. Now we do have some other more specific RET inhibitors coming along. Uh, I think the one that's probably shown the strongest preliminary data is one from Ellipsis. So that's a company that's now developed a RET-specific inhibitor. And results of this were recently reported at last year's ASCO meeting. I believe the drug has substantial activity even in patients whose tumors have grown after being treated with selpercatinib or pralsetinib. So I think that's a very promising drug. And then there are different combinations that are be tested where you take a standard drug like selpercatinib or pralsetinib and add other drugs on top of it. And I think that's another promising approach. But there we want to tailor the combinations for a patient's particular tumor. There's not going to be one combination we think that's going to be effective for